guest is Congresswoman Debbie Wasserman Schultz. She represents Florida's 25th District. Congresswoman, thank you so much for joining us.
Thanks for having me, Maggie. Good to be with you.
You have a busy day, and in fact, earlier today, you spoke on the floor of Congress and called this bill, quote, a vile Republican plunder of working families, seniors, and veterans. 4 recent polls would show that Americans agree with you. On average, 55% of Americans who've been asked about this bill oppose it, while 31% support it. Broadly speaking, can you give us an overview of exactly how those working families you referenced will be affected by this agenda?
Sure, in several different really concerning ways. First, the bill coming back from the Senate kicks 17 million people off of their health care. And that is a combination of people on Medicaid, as well as people who would no longer qualify for subsidies to reduce the cost of their premiums in the Affordable Care Act. That's because Republicans made these massive restrictions that will end up causing people to lose their health care. In addition to that, it makes massive cuts, $4 billion in cuts to SNAP benefits, nutrition assistance cuts that essentially tell our veterans who use SNAP benefits, our children, our disabled, our elderly, you are going to have to go hungry and figure out how to put food on your table because we're not going to provide nutrition assistance for you anymore. It also is going to force many rural hospitals to close because of those Medicaid cuts, as well as nursing homes, because the overwhelming majority of nursing homes in this country have a high percentage of their patients who are in their nursing homes paid for by their Medicaid coverage. There are many more things, but the other massive problem is that at the same time it has these horrendous cuts, it also blows a $4 trillion hole in the deficit and a $5 trillion increase in the debt ceiling. That's so that Republicans can make enough room in the debt ceiling to transfer and give the most massive increase in tax cuts targeted at millionaires and billionaires and the well-off. And that is all in this entire bill. That is the ultimate goal of this entire piece of legislation. So it's extremely troubling. The deficit portion is especially troubling because it triggers a $500 billion cut in Medicare because the increase in the deficit is so significant.
Is there any part of this bill that you agree with or that you think would provide value to the American people?
This is the most troubling, abominable bill that I have ever had in front of me as a legislator in my entire career. I can't really recall a time when I had legislation in front of me that had no redeeming qualities whatsoever. It doesn't have to be that way. We could certainly make reforms, and we could certainly, work together. But this is a MAGA extremist Trump bill that was rammed through originally in the House in the dark of night. We voted on it at 3 a.m. We had no time to review it. And essentially, that's what they're doing with the bill that came back from the Senate. Only the bill that comes back from the Senate is even worse than what was passed out of the House.
Even worse, yet you reference reforms, and this might be a more procedural question, but just how much of the bill could change as Congress debates it? Are there any parts that could be dialed back and made more perhaps reasonable in your view?
Well, certainly, if the Republicans decided to work with Democrats and reached across the rotunda and worked in the Senate and went back, rather than ramming what the Senate passed last night through the House or attempting to ram it through it, we could go to a conference committee. And a conference committee would require input and feedback from Democrats. The Republicans are still in the majority. They would control much of that process, but there would have to be a negotiation. And in negotiation, we've been able many times over the years I've been in Congress to reach a bipartisan budget deal that ensures that things like making sure the tax cuts are targeted to the middle class and working families, as well as people who are already successful, and make sure that we have more balanced changes to healthcare programs. We certainly don't want people to get Medicaid that aren't eligible for it. The Republicans are making up that there are these millions of people, according to them, that are on Medicaid who are undocumented. That's already against the law, and there are not people who are undocumented that are getting Medicaid. So, unfortunately, the lying that is taking place on the Republican side about what this bill really does is, I think, making things worse for them rather than making it easier.
I started this conversation citing a few different pieces of polling that show how broadly unpopular the quote-unquote big, beautiful bill is. What are you hearing from your Republican colleagues? Do they see voting for it as a threat to their reelection chances? And as such, are they considering voting no?
Well, they should. I mean, I think that just like in 2018, when they tried unsuccessfully to take the Affordable Care Act away and repeal it and yank healthcare away from even more people, voters rejected it and rejected them, and Democrats won the majority of the House of Representatives. I'm a breast cancer survivor, and I know from just growing up with parents who always said to me, Debbie, if you don't have your health, you don't have anything. And I learned that firsthand when I found a lump in the shower doing a routine self-exam. And when I was 41 years old, I became a breast cancer patient. And when you're staring down the barrel of your life, and on top of that, Republicans now are going to tell people who might be diagnosed with cancer that, no, we're taking away your healthcare coverage, so you're going to have to just figure it out for yourself. That means that you're going to have a lot of people die. I mean, this legislation will kill people, because you can die as a result of not being able to afford to go to the doctor and get a problem taken care of, like cancer, which when caught early in many cases because of the incredible research progress we've made, can actually be resolved for someone and they can survive their cancer diagnosis. But Republicans don't care. They don't care about the increased costs. They promised that they were going to focus on affordability, and instead what they're doing is focusing on their wealthy supporters, and they're increasing costs in this legislation massively for people who can least afford it. And that's really unpopular because, for the most part in America, our folks care about one another. They don't want to see healthcare yanked away from people that they know need it. They don't want to see children go hungry and not be able to get, assistance for their school lunch program, or for families not to be able to have assistance for their groceries, and kids have to skip meals, or parents have to go hungry so that their kids eat. In what moral universe is it okay to take away people's health care, cut their nutrition assistance so people go hungry, all so that you can give more tax breaks to the wealthiest, most fortunate Americans? I think that you're seeing polling, Maggie, because you have a lot of moral people who are telling the immoral colleagues who've presented this bill that they need to stand down.
Those are important stories, because the Congressional Budget Office estimates that this bill, if passed, would reduce federal spending on Medicaid by nearly $1 trillion. And that is such a large number that it's hard to conceptualize. So what you're describing, Congresswoman, is a real-world cost in which people lose their lives because of this bill.
They do, because if you can't afford, when you have Medicaid, that is healthcare insurance coverage. It is subsidized health insurance coverage by the state for people who fall into a certain income bracket. And that means that if you have Medicaid coverage, when your child has the sniffles, like when they're on the CHIP program, the Children's Health Insurance Program, or when they have fever, or when you, like I did, find a lump and you're on Medicaid, then you can go to a doctor and you can get that lump checked out, and you can have a mammogram and preventative care, and maybe catch that illness early. When your Medicaid coverage gets yanked from you because of this bill, because you can't make $1 trillion in cuts to this program and say that it's only people who, fall into the waste, fraud, and abuse category. I mean, there's just not $1 trillion of individuals who are on Medicaid due to waste, fraud, and abuse. That's just outrageous and unrealistic and false. And so what you're doing is you're taking away that lifeline, that safety net, the ability for people to be able to make sure that they can take care of healthcare challenges at their start and survive them, and then just get basic access to well care. Go in and get a checkup. Make sure that you actually stave off illness. Make sure that we don't cut people's nutrition assistance, and that they can put food on their table. The people I serve with in Congress who are planning to vote for this bill, they don't have to worry about where their next meal is coming from. They don't have to worry about what they're putting in their grocery basket when they're food shopping, and it's just callous and indifferent for them to not be thinking about the consequences of their vote.